Okay.
Okay, let me see. Got it. Okay, I'm going to share. Okay. Let me get to this one. There we go. Okay. Well, hi guys. So today we're just gonna go through a case study, and we're gonna go through I don't want to do that one. I think I want to do this one. We're just gonna go through and talk about what it would look like meeting this client from the beginning to the end. But today we're just gonna focus on the first few stages of what it would look like. And I know we've talked about like how I do intake and how I present it to parents. So I won't go, I mean, unless there was somebody that wasn't here from the first time or you want just a repeat, just let me know and I can explain that again, but I don't want to be too redundant with you guys because it can be a lot of information.
Okay,
So
so
yeah,
here's what else we want to do. I'm sorry. So let's I want Natalie to be able to do this since we're recording it, that let her just go ahead and present everything and save kind of your questions, and then we'll just have a question and answer period. Does that sound good?
yeah, that sounds good. We can
All
do it.
right. All right, thank you.
Okay, so this is our case study we're going to be going through together. I tried to pick a child that was a little bit older. And this may sound like a weird thing for someone to come to therapy for, but it is based on a few of my real clients. So just kind of loosely based. But so yeah, so this is Maria. She's a 9-year-old girl whose parents are requesting play therapy. And Maria has a fear of throwing up to the point where she will work herself up to actually throwing up. And so her mom gives you some information when you meet with her that it only happens at nighttime during her bedtime. She'll begin to have this anxiety. And everywhere else, she's a really normal child. She does good in school. She has friends. It's just a phobia that comes up for her and is causing her a lot of anxiety and panic. So we're going to go through kind of what it would look like for me to meet with Maria the first few times today. And then I'll give you an overview of what else we're going to talk about. So you can get kind of an insight of like how I'm like conceptualizing everything in my brain. Let me go to the next one, maybe. There we go. So first of all, before I would even meet with Maria, I want to establish what type of theoretical orientation I'm going to do in the playroom. And so the importance of this is, so with adults, sometimes we can be more eclectic. With kids, it's important to have a roadmap in your mind of how you're going to frame therapy. And so usually with play therapy or working with kids, you're going to be one or two things. You're going to be either more directive, where you feel like change occurs, where you are like planning interventions and you are bringing things for them to do in the room. Or you may be non-directive and you believe that the child should just have full autonomy in the playroom with your limit setting, and you're just going to track their behaviors and you're going to track their play. Both of these work, even though I think before I learned about play therapy, I thought child-centered sounded like it wouldn't be effective. And actually the data really supports it, especially with younger children. So Maria's 9, and so I'm going to assume probably before that child-centered would be a little bit, it wouldn't be developmentally appropriate. Of course, I would meet with her for the first session to really assess that, but I would probably go in a more directive approach. My approach, and there are a lot of different theoretical orientations just in play therapy. I feel like when I started to learn about play therapy, I felt like I was learning how to do counseling all over again, because there were so many different approaches and theoretical orientations. And so one that I use a lot is Adlerian play therapy, which is really focused on, it really says like the relationship is what brings the change for the child. And so that's what I like to use. And that's kind of the roadmap I will show you, just because that's what I know the most about. There's also Gestalt play therapy. There's CBT play therapy, which I incorporate sometimes. It just depends on the child. There's Jungian, there's psychodynamic, there's filial play therapy, which I do sometimes too. And you can do EMDR if you're trained in EMDR too. So I use EMDR with kids as well. So yeah, we're going to choose Adlerian play for this, keeping this in mind. And so just also keep in mind, it may not look the same as how you would do it if your theoretical orientation is different than mine. So these are some things we're going to go through, kind of what the intake would look like with Maria, what the first session would maybe look like, some ideas, and then we'll have some question and discussion. So the first thing, and I know we've talked about this before. So first of all, I'm going to meet with Maria's mom or dad, both of them together, whoever wants to be in the room. Just as long as I need at least one parent, I'm going to meet with them. I'm going to review informed consent about what play therapy is, what play therapy isn't, what's realistic expectations for them to consider. I'm going to talk about, because it is something kind of medical, I'm going to talk about making sure that they're also getting it screened with her pediatrician. And I'm also going to give them the waiver that, play therapy may not work, and that's okay too. And we'll always be discussing that. So then the intake process, and it's taken me some practice to get really good at being a good intaker with parents for their child. There are questions that you're not asking with an adult that you're needing to really ask with the parent to get the full picture. And so one of those things that I have learned to do, and I'm going to just show you a different document really quickly here. I have it pulled up right here. So this is something that I use. I've never completely filled it out because it is I had to fill it out for a class I was in. But when I'm using with my real clients, I really like to use this table, and it gives you another side as well. And I can send this to Doug if anybody's interested in using this. And what I'm going to do is when I'm sitting down with my intake, I'm going to list all the behaviors that are concerning for the parent. So like they may say, oh, like every night, she gets so worked up, she's crying, like it's hard for her to breathe, she's feeling panicked, and then she throws up. So I would write down all of those symptoms separately. So like crying, maybe she cries every other night. The throwing up, that's like once a week, it gets to that point where it's that bad. The difficulty breathing, that's like every other night we're dealing with that. And so I'm writing down the frequency because I want to establish a baseline when I'm keeping my goals in mind. So then when I'm writing in my treatment plan, I'm going to say, I'm going to talk about with the parent. I'm going to say, what do you feel like is a realistic goal to set right now? So maybe it's, instead of her panicking every other night about throwing up, our new baseline is she's going to decrease her anxiety to once a week. That's a good realistic, or maybe it's just one less night than what she usually did. And then you can adjust your goals as needed as you're working with the child to where it could get to where she's not panicking every night. But I want to establish a baseline so parents can see change. And when I meet with them, usually what happens if you're not doing this and kind of quantifying the data, parents are going to say, it's not working, she's still panicking. And then if I've already established the baseline, I can go back and say, well, has it decreased at all? And then they may notice, yeah, it actually has, it's getting better. And parents love to see that because they like to see progress. They're not always going to be in the playroom with you. And so this is their way of seeing that it's effective and it's working in the process where you're getting it to where it's completely going away. They like to see the change. So then I'm going to be writing down, this is so important. Where is this happening? What time? So I would say nighttime. It happens at home. She's never panicking at school. And so the reason why you want to establish the situation is it gives you a clue, maybe what's going on in that environment at that time. So it may be a child, it's only before they go to school, they're having a panic. Maybe I had a kid who was only before they saw a substitute teacher, they would have a complete anxiety panic attack. And so it's good data for you to know. And then the severity may be based on if it's happening daily, it's probably very severe. Use your DSM criteria for the amount of times it's happening. I like to know developmental history that's related to the symptoms. So maybe I'm going to be exploring the history of her panic attacks and throwing up. Maybe it started, when she was 3, she had the flu really bad and it made her sick every night. And so since then, she just is completely scared to do that again. So I would write all that in. Think about a 3-year-old, what their mind is like at that time. And maybe in that area, she may be stuck, as a 3-year-old, when she goes back to that trauma. So knowing the age, about different history, things that have happened, any factors, any cultural influences that you think would be significant. And again, I don't really completely fill all this out. I just kind of use it as a guideline when I'm meeting with the parent and conceptualizing behavior. So that's a really helpful sheet if you like me, and if you're like me and you just need some extra, I don't know, I like organization, and I feel like it just helps me keep everything together. So that's what it would look like when I'm doing the intake and doing my treatment, my planning my treatment. I kind of touched on this again, but I'm going to be giving parents kind of an idea what's going to happen in the playroom, and I give them a tour. The first time I like to let the parents take pictures of the playroom, so that when they go home to the child and tell them, you're going to be meeting with this lady, once a week, and you get to go here. And then the child gets to see the pictures before they go there. So they get to see, oh, this looks fun. Like, I get to play. And a question I get from parents all the time, so you may get this question too, is what do I tell my child why they're coming here? Like, if I tell them they're coming to talk about them throwing up, they're not going to want to come. Like, that's very embarrassing. So this is what I learned in my training, is to tell them, you're going to go and you're going to meet with this woman named Natalie, and she's really nice, and you get to play with her. She's good. Sometimes she'll have things prepared for you. Sometimes you get to choose. And it's not lying, because it is the truth. And so then they come in, they start to build a relationship with you. And then eventually, the issues are going to come out once you establish that relationship. And that way the child doesn't have resistance or anxiety to come in. There are a few exceptions. I did have a young girl who was sexually molested by a family member, and that was the reason why she was coming to see me. And so I had the parents in the room the first time with her, and we kind of just laid it on the table, like, this is the reason why you're coming. And I had to establish that it wasn't anything she did, but she was hurt, and so we want to help her and support her. And I did that with the parent support, and they were there when we established that. So there may be a few exceptions on maybe it is you're going to need to address the elephant in the room. And then I'm just going to schedule the next parent meeting. When I meet with them, I'll say, okay, in about 3 to 4 sessions, I'm going to reach out to you. We're going to schedule time for you to come back in, and we will kind of see any progress or any concerns you're having still. And so I talked about this, making sure you're establishing a new goal with the parents in the first session. So I would say, what do you want play therapy to look like? What do you feel like is a realistic goal for us to set together? I'm talking all about that with them. Yes. So then Maria's going to come in the next week, and it's just going to be her and me in the play therapy room. Unless she's very anxious and wants mom to stay in the room. I've had some exceptions where that's happened. And so I'm just going to be working on, my first stage is always building relationship. I'm not going to go even near her fear of throwing up unless she brings it up. I will, maybe reflect that fear to her, but I'm not going to do anything deep. We're just going to get to know each other in this time. So what would be maybe appropriate for a 9-year-old girl? Usually it's Jenga. That's usually the first thing that they'll go for. And so I'm just gonna have questions, nothing about her anxiety. It's just going to be about her. Like, what's your favorite sport? What do you like to do after school? Who's your friends? And then I'm going to answer some questions too. So when I pull it, and my answers are always going to be appropriate for the child. Maybe I'm going to give examples of maybe when I was a child. Oh, like when I was 9, my favorite subject was social studies. And so then she can feel more relatable to me. And there's tons of different activity ideas. As long as you're just building rapport, you're getting to know them. It could even be like making slime. That's a huge thing that kids like to do. So, and I've done it with many children when they're first getting to know me. So just anything that's relaxing, calm, like easing them into the process. And that may last. It really depends how long the relationship building stage needs you to take. Some kids, after 2 sessions, we're ready to move on to the next thing. With other kids, it may be like 5 to 6 sessions until they feel comfortable with you. And so it's just hanging in there and you using your intuition as the therapist of how much longer they'll need, and letting the parents know the reason why, because sometimes they may be like, why is my child just making slime every time they're going in there? Why aren't you addressing it? And I'm really explaining it's really the foundation that needs to happen before we can get there if you want to see actual progress. So this is kind of an insight how I will walk you through these stages from here on out, but I'm just giving you a glimpse into the roadmap I have in my head. And it's important to have a roadmap because before I got training in play therapy, I was honestly like hodgepodging it every week. Like it was just like, okay, we did this week. I'm just going to find another intervention for anxiety on the internet or Pinterest. And I was literally just winging it every week. And I didn't have like a roadmap in my head of where I was going next. And this is why it's so important to have this. And I think this really made the difference of me seeing progress in kids, with sticking to a theoretical orientation and also having this roadmap in my mind. So this is really more Adlerian, but I love Adlerian. I think I've seen a lot of progress with kids with it. So after I've built a relationship with her, so let's say it took about 3 weeks, like now she feels comfortable. She was making slime and she mentioned like, I get really worried when it's nighttime and I feel like I'm going to throw up. Like, I feel like this slime could really help me feel calm. So then that's like my gateway. And I'm like, okay, she's mentioned it now. So we can go into it. So the next stage would be exploring interpersonal dynamics. So intrapersonal is really what's going on inside her mind. What does she believe about herself? What does she tell herself? I'm learning her attitude, her personality, her self-image. And so I will walk you through interventions I would do with this child at this stage, but we will save that for another day, because this is the next step. And then I'm also going to get to know how she interacts with other people, who are important people in her life, who's in her family. We're going to get to know all of those things in this stage. The stage after that when I feel like we've established understanding about that, I'm going to then help her gain insight into her problems. So it's helping her be more aware of this pattern, what happens when she's feeling panicked, maybe what happens before. So she's going to understand a lot about this issue and, maybe get more insight than what she had before. And it's setting, this stage is always my favorite because you kind of see like the light bulb go off with them, like, oh, like this is why I do this. So they're just gaining insight, but it's also really important for them because they get the buy-in on the next stage, which is when you're doing the interventions, it's the working stage. Kids really need that buy-in to that process, or else they're just doing a craft with you and there's really no significance. So once she understands the importance of why she's there, then you get into the working stage and then you're giving them interventions, you're giving them coping skills. You're helping them, they're really learning like a more positive belief about themselves, or learning how to have different feelings, learning how to manage hard feelings and behaviors. So this is really like when you are doing the work. And again, each stage just takes as much time as you need it to be. In my brain, I always think I have about 20 sessions is what I always tell the parents. That's usually like the clinically studied, approved amount of time it takes for a child to change. Some kids take less, some kids take more. And so in my brain, I have 20 sessions and I'm going to kind of break it down in those 20 sessions, how many times, what I'm kind of doing with them. And then once the child has gotten those coping skills, things are doing good at home, the parents are like, man, like it's really rare if she has an anxiety attack, like she feels fine. You've gotten tools, like she's implementing them at home and we're ready to terminate. So you get to that place, you need to have a mutual understanding with the parent. And the sad thing is sometimes it doesn't get to this stage. Sometimes parents will end or they move, or They get frustrated. They're like, I don't feel like this is working, and they won't listen to you. So then they leave before the stage. But when the stage gets to happen, it's really powerful. And it is its own stage in itself. Before getting training, I thought that you really just needed one session for terminating. You do an activity and you send them on their way. You really need like a few sessions, depending on the child. We're going to be focusing on terminating for maybe like 4 to 5 sessions. We're going to be doing different interventions, talking about what it's going to be like. You can have a countdown in your room. Like they get to take a sheet of like a post-it note off the countdown every time they come in here, so they can see, I have 2 more times I get to see Natalie. And then you kind of talk about what you're going to do together. So it's important for them to have closure in their therapy and to feel like, they're not leaving because it's them. They're leaving because it's a good thing. And they're leaving because, they met their goals. And so that we can talk through what that stage would look like. So it's kind of an overview of what we're going to do. So we talked about the intake process today, and then the first session, what that would look like. But based on all of that, let me see, I'm going to stop share. Based on all that information, I'm wondering if there's like an area that you guys feel like you need some more clarity on, or if you have questions on maybe a client, how you would start the process with them. That's something we can talk about now. So
Hey, yeah, thanks for doing that. I want to ask a question about, so when they're ready to terminate, what's it look like? What are some of the signs you look for in a child that they're ready to terminate and you're kicking them out of the nest? What does that totally
there's
look
a
like?
whole list, and I don't have it completely memorized in my head, but I know. So first of all, you're seeing you have a decrease or just a complete stop in all behaviors. One marker I learned is that the child feels confident in the playroom. So one example is if they're still asking about other kids you see or what other kids do in the room, that's a sign your work is still not done. And because I've noticed I have a lot of kids that they'll still be like, they'll ask about other kids, like, what does this kid do? Or they'll want to hide toys in the sandbox for another kid to find, or they're thinking about like other kids. And I've heard it's a way to test your relationship with them, because it's like, they see other kids, sometimes it's like a threat, like, oh, you're not really like, you meet with other kids, like sometimes it's a shock to them. And so when they're not asking about other kids you're meeting with, that's a good sign that they worked through some things, they feel secure. If the parent is like, yep, like we're not seeing it at home, that's a good sign. There's a few more. I'll have to find that list, and we can talk about that when it comes to the terminating stage, what
Excellent.
we go through. So
Yeah, perfect. Awesome. So do you have a list of what the stages look like? I know what it looks like in couples counseling or in individual counseling. What do the stages look like in child counseling?
yeah. Like, are you talking about how a child's going to react in each stage,
Yeah.
or okay.
Yeah.
I don't really have um it's kind of different than like couples, or I'm just tracking like weekly what it's looking like and what improvement I'm seeing. I'll actually show you this. This is, I don't know if you can see it, but I use this. It's a child-centered play therapy note. And so it's a lot. Sometimes with older kids, I won't use this one, but it's a lot more descriptive of the process. Like, so you're seeing how did they transition into the playroom? Like, oh, like they were really nervous. They like had to hug mom like 10 times before going in the playroom today. Or maybe they just got up off the couch and walked with me in there. I'm talking about their mood in the playroom. I'm talking about what they did, if they're meeting developmentally appropriate markers, if they're able to clean up, if they're, showing me empathy, if they're like, I spill like this, I'm clumsy, so I'm dropping like crayons on the floor all the time. Like, did the child say, oh my goodness, I want to help you? Are they picking it up? Or are they just looking at me? Like, I'm kind of documenting that, like how they're reacting and how they're responding to treatment every week, so I can go back in my notes and really see that data. And so, yeah, so I would say like the stages are, it's like the relationship building, then I go into exploring and interpersonal, then I'm going into the getting insight, and I'm going into the working stage. So that's kind of the model I have in my head. And it just really depends the child, like how long they're in each stage.
Sure.
Um, yeah, and it's just gonna look different. And you choose your kind of your intuition based on what you're feeling. Like, okay, I feel like we've mastered that. Let's go to the next one. Um, but yeah, I hope I answered that question right.
Yeah,
I
yeah.
Yeah, and I would say kids do sometimes start to get worse before they get better, like adults too. So maybe halfway through, all of a sudden they're regressing, and that is normal as well. Um, so it's
Yeah.
just, yeah, really checking with the parents is an important part to see what's going on.
Well, and
Yeah.
that's one thing that I would say is probably one of the biggest things is working with the parents and have them working outside of the session. But when anybody's changing, it's going to disrupt their life, because they only knew the coping skills or whatever it was previously, and now they're being introduced into new behaviors, and so it isn't going to take or whatever, it's going to be tough, and so there's got to be a lot of patience on everybody's part, even the kids part, to,
Yes.
to
Yes.
through this change. So yeah, I appreciate that. Who else has a question for
I
Natalie?
do.
Go ahead, Camille.
Okay, Natalie, I was having a question because, and I'm sorry, I missed some of the information, so I'm not sure if you already covered this yet. But I have a minor that I see on Saturdays, um, but they are 15. And I've kind of resonated really with what you were saying about kind of just finding activities and kind of just not really sure what to do with them. As just a basic story, he's being forced into therapy. He is adopted, and they are trying to see, they think he's depressed. He says he's not. I'm not sure on a diagnosis yet. I've tried a few different things. He's really guarded. I've been seeing him since January, the end of January. And the parent session I had, they haven't seen any progress. I'm not seeing any progress. So I'm just kind of trying to see what, because you said a roadmap. So I don't have one. So just
Yeah.
kind of,
Yeah, no, I felt the same way. And with teens, you can use this approach as well. I used it with some of my teens, the ones that are just more resistant to like doing talk therapy. I have this roadmap in my brain of like, building relationship, exploring their world, then helping them gain insight, then doing the working stage. So, but it's just you're not going to be like playing on the floor with cars with the 15-year-old. It may just be like you having games, or maybe like if they like art type things, you can bring those into session too. And I honestly, when I learned about like this type of roadmap with working with kids and teens, I people I was working with already and I wasn't seeing progress, I just took them back to the beginning because I was like, we probably missed something along the way. So I just started building relationship rapport again with them. And I explained that to the parents, like this is what I'm going to be doing with them. And I've just learned more about how it can be effective. And so this is why I'm doing it. So I give them a rationale. And so then I would just, if you feel like you don't have a good like relationship established with them, go back to relationship building again. And some kids are just not ready for therapy as well. So if you may come to the crossroads of that and just feeling like right now this isn't effective, or maybe he needs more, or maybe yeah, there's just it's really hard to know for sure. But that's what I've done in the past. I've just gone back and see what I've kind of missed along the way before I had like this conceptualization in my brain. So yeah, I think it's helpful. And I saw change once I started doing that for sure. And
okay.
I can give examples from here on out, like this is what it would look like with Maria. She's 9, but if Maria was 15, this is another suggestion we could do, because I know a lot of you guys don't work with young kids, but maybe you see more teens. And so that would be helpful for you guys to see like what I would do with this age, what I would do with her if she was this this age. So I could do that for sure.
Yeah, thank you.
Yeah, who else has a question? So Natalie, what's the parent meeting look like? So let's go back just a little bit before. I know you explained a little bit. If we can go just a little bit more detail about the very first meeting with the parent, before even the child comes in. What's that look like? I mean, the rapport, you're setting expectations, you're working through, you're putting in their mind with a vision of what change looks like and what to look for outside of the session. What kind of things do you talk to?
Yeah, what I do usually is I just introduce myself, I show them the room, like this is where they're going to be meeting. And then I usually just jump into, okay, at the last 10, like 15 minutes, I'm going to have some information for you that's going to be really important for us to cover, but I want to hear from you, like what your concerns are. And so I'll say, I read on your intake that, Maria is dealing with blah, 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 blah. She's throwing up, like, that's so scary. Yeah. Tell me a little bit more about that. So we'll start there. And I just have my like intake paper right in front of me. Sometimes the parents are really awesome and they're really detailed in their intake. And sometimes they just put periods or like client did not respond. And that's never helpful. So I'm making sure I'm going really reading what they wrote there, going back in. I come in, I like highlight things. I write down follow-up questions before I'm meeting with the parent the first time, like things I would want to know more about that were kind of vague on the intake paperwork. And so then I'm just following through with that. Sometimes it's kind of supporting the parent and helping them, feel like they're not a bad parent, because they'll be embarrassed. Like sometimes it's like, this is embarrassing. I can't help my child, that I have to bring them somewhere. I've had parents say that to me, like, I feel bad. I'm not the one that can help them. And so I kind of encourage them, like, but I'm going to give you tools so that you are the one. Like, I always want them to feel like, they aren't powerless, but we're going to work through this together, and it's going to be a team effort. And also normalizing, sometimes kids just need another voice in their life to help them. Sometimes they're not listening to mom and dad, so we're all going to work together to do this. If I notice it's a school thing that's really happening out at school, I will go ahead and give mom and dad like the release of information waiver, so I can get a hold of their teacher or their school counselor early on, so I can see from them. I can give them a call, like, what are you noticing? How are they in the classroom? So I'm getting that picture in my brain before I meet with the child too. So sometimes it's doing that. If behavior is happening in school. And yeah, and then once I get all the intake information from mom and dad, I feel like I have all the information I need. Then I'm going to talk to them about my expectations. So I'm going to say, I always expect that if the child's under 12, I'm going to say, I need you to stay I need you to stay on the premises. Like, you can go be in your car, you can wait in the waiting room. If the child's like younger than 5, I have them just wait in the waiting room, because I don't want somebody having an accident and I have to be the one to like awkwardly try to help them. So yeah, so I just set my expectations there, and also use your intuition. Like, even if the child's 10 and you feel like it's going to be maybe rough the first times you meet them, ask the parent to stay there. And I also tell them, if I have a child that I'm concerned about, like I'm about to meet, and the mom's telling me they're so disruptive, like they are aggressive, like all those things, I'm going to be telling them, if they're going to be destroying property, if they're going to be aggressive towards me, I am going to give them a warning. And if they break that warning, we're going to be done with play therapy for that day. So maybe they're only in the room for me for 10 minutes. And I'm going to tell them, you're going to have to pay the whole session. So I tell them that before, because you don't want to be stuck in where the mom's like, I'm not paying for, the whole hour. You've already told them, and they've already, signed that they're going to be meeting for the whole hour. or they're gonna be paying for the whole hour, even if they don't meet for the whole time. And so, either the parents are gonna, and I would explain the importance of that to the mom and dad. It's so the child feels accountable to their actions and knows that if they want to play next time, they're gonna have to play by my rules and not by, you're not gonna get my attention by doing bad behavior. So it's really, it's reinforcement. It's if they're gonna be hitting me with a Nerf gun in my face, then maybe next time they're not going to get the Nerf gun until I feel like they're ready to do it. So it's really a lot of behavioral reinforcement with those type of kids that you're working with. And so next time you may only have like 5 toys set out for them. These are what you can choose from today. If they can handle that, you can say, then next week we can add in this game, or next week we can add in this. I had to do that with a child who was just really out of control. I had to bring it down to only like 5 activities, and we weren't even in the playroom. And that was a much more enjoyable experience for me than having him in the playroom with all the options. And so I'm telling parents that from up front.
That's
And
great.
yeah, and then I'm also telling them, I need your buy-in to the process. I need you to meet with me. And if you're not able to do that, or you don't feel like, that's something that's realistic for you, then this process probably isn't going to work the way you want it. So I'm always explaining, I'm not magical. I'm with them an hour a day. I'm going to really need your help on this. So
Mhm.
So explaining all that, and then I explain how play therapy works. So it's maybe showing them a video to educate them, giving them a pamphlet, talking to them about how the child needs it developmentally, because there may be resistance to, like, what are they even doing in the room? Are they just playing? Why am I paying for this? So it's really explaining to them all of that. And I feel like once you establish a good relationship with the mom and dad, like, you're golden. Like, those are like the easiest clients to work with if the parents have really good buy-in and they trust you. It's really hard when a parent is like suspicious or doesn't
Yeah.
get it or doesn't want to help. So
Yeah, absolutely. How do you help? So you meet with them. How do you gain their buy-in for their work outside of the room? I know it's all about the process, and trust the process, right? So how do you get their buy-in?
yeah, I usually will educate them about the child's brain and neuroplasticity. I like to show them. I have like a video that's like 2 minutes, and it talks about, like, I do one action, it's gonna, if I start to do another action, I get like a rewiring of my brain. And so I talk to them, if you want your child to have change, then you're going to have to implement this daily for them to have that neuroplasticity, for their brain to be able to rewire and to have a new behavior. Having them come in for an hour a week, it may help. Like, some kids, that's great, and I don't really have them do much at home, but a lot of kids are going to need that extra help at home, or the parent to practice the coping skills with them, or to remind them in a tantrum. These are go blow your bubbles, or go do your breaths, or whatever. I've worked with them in the room. They're going to need the parent to help them in that, or else the child's just not going to change. And I feel like that's where I had somebody in my internship who was a kid who had really bad anger meltdowns. And like, I would work with them like in the room, but the mom wasn't really doing it. And then she would complain. She'd be like, well, I don't see any progress. Like, this breathing doesn't work, or, we tried it before and it doesn't work. So now that I have knowledge about like neuroplasticity, I have knowledge about how the brain can change, I'm really going to hone that in, because, they can't argue with science. Like, they can't argue with that. Like that, there's been medical journals made about it. And so they're going to have a lot more buy-in and really trust me as a professional. Like, okay, she knows what she's talking about. I can trust this. And then if they're not doing it, I'll just remind them, like, there's not going to be change if you're not doing that. And this is why.
Excellent. So you give them a document that is parent expectations. How's that generally received?
Usually with the people we would meet with at Abundant Life, they're like, yeah, like anything. I would say that's like 75% of our people we meet with. There are like every now and then you're gonna get a parent that is like, well, I can't wait in the waiting room for 45 minutes. Like, I gotta go do errands, or like I don't think that's realistic. And I have to tell them that's our policy. So yeah, I would say it's not the common response. It's usually it's parents when they feel so overwhelmed, they just want to dump them on you and go, or it's more of a parent thing. And so yeah, I would say it's not as common, but
Okay. So when you see them say, so is that usually an issue of greater things, is when you see that type of attitude?
yes, for sure. It gives you a clue into the family dynamic, and then you can kind of realize, like, if you remember the different types of family roles, like, I can't remember what theory this was in, but it was like, there's the scapegoat, there's the enabler. I think this was with like addiction, but I think even families that don't have addiction can have the scapegoat of like, all of our problems are because of this child. And it's really like, and then you hear from the child, mom and dad are yelling at each other every day, and I cry myself to sleep. And then you're like, oh yeah, this is more of a family dynamic. This is more maybe a mom or dad problem, and it's getting put on to you. And so that's when I would refer to like family therapy, or I would refer to maybe the parent getting couples therapy or getting their own therapy. And yeah, sometimes it's met with resistance. Sometimes it's met with like tears, and they're like, I know it's me. I know it's me. Like, this is how my dad dealt with me, and this is how I'm dealing with it. Um, those are really cool sessions when you can get that to happen, but sometimes it's not. It's the parents just not willing to admit that they have buy-in into the problem.
Mhm.
Yeah.
Do you give them tough love at that point, where, saying, hey, this is what I'm seeing?
Yeah,
Uh,
I
do you,
do. Yeah, I
what's that
do.
conversation look like?
Yeah, I'll explain. Like, I'm very kind when I do it because I know there's a lot of shame that is met with that. So I just tell them, I know we haven't been seeing progress with your child, or, we're at a place where I feel like if you don't get interventions done, there's not going to be any change. Because sometimes, it is changing the home environment for the child to grow. Because if you think of like the Maslow's hierarchy of needs, like, I need safety before I can, be self-actualized or whatever. So if the child's not feeling safe, they can't grow, they can't learn new behaviors. And so I'll explain that to them, like, what does your home environment look like? Does it look, safe? Does it calm? Do people talk in um you know are my noise levels like, is there a lot of yelling? Is there degrading? And maybe it is like exploring conflict styles with mom and dad, or doing the four horsemen, and discussing like, what does that look like when you're in conflict, and how do you think your child is interpreting that? Because that's not safe to be criticized all the time. It's not safe to be yelled at. That doesn't feel safe. So it's not. And explaining what discipline is and what discipline is not, is it sometimes good to psychoeducate your parents on, because they just sometimes just have no clue. Like, that's how they were raised, and they think if I'm tough on my child, if I yell at them, if I'm like spanking them all the time, like, that's really going to fix the behavior. And it's like, well, no, we're not seeing change that way. So kind of showing that to them, like, what you think is working, it really isn't working, and you're going to have examples why. And then you're going to say, but this is something that can help if you're open to exploring this. And then you can be kind. Like, if you feel like the parents are totally resistant and you're not seeing any change with the kids, I would say, I don't want to keep wasting your money if this isn't going to be changing, because that's what would happen basically. if
Mhm.
if you think that an hour with me is going to change, it's really not, if you don't fix this problem. So yeah, I would just be really kind. I would have all my evidence ready because they're probably going to come at you. So I would just explain why. And yeah.
Kill them with love, right?
Yeah.
I got it.
That's,
Okay, we have just a few more minutes. Anybody had any last minute questions?
Yeah. So I wanted to ask if, so you said go back to the relationship building skills. So maybe I need to see what would that look like with a 15-year-old, because when they're not very forthcoming and you've, probed and tell me more about that, blah, blah, and they, give you very little.
yes.
And that's been happening for, I get the most out of him when he's writing something on a activity, but even then it's still vague, but you get something, a little bit more insight, and some things were corroborated with the parent meeting that I did a couple of weeks ago. But so yeah, if I'm going to go all the way back to the beginning to try to start this, what would that look like?
Yeah. So off the top of my head, interventions I've used with teens to build a relationship. So like there's the super classic like Uno emotions, when tell me a time when you play a blue, like talk to me about a time you felt sad. And so even if you're getting like a little blurb like I was sad when I got in trouble for being on my phone, I shouldn't have, or something like that. Then you can just reflect that, like, oh man, yeah, that's so hard. Like that you want to be on your phone and that makes you feel so sad. I wonder if also made you feel frustrated, or so you're just going to be kind of reflecting it. And like the point of a relationship building is so the child or the teen can feel like that unconditional positive regard. Like I can tell Camille anything, and she's going to listen, she's going to try to understand what I'm telling her. She's my advocate. She's not my what am I like thinking of? I'm not up against her, she's not my enemy. But she's really
Yeah.
for me and help me. And so Uno is a great one with like the emotional questions. I have a stack. I just got them on Amazon of like getting to know you questions for teens, or I don't know if exactly that's what it's called. I can't think of it, but there's tons of different like cards you can find on Amazon. And it'll just be like, who's your best friend, or what's your favorite subject, or what's your favorite time of day, things like that. So you could play Jenga, you could pull a Jenga thing, answer a question card. You're going to just be supporting their answer that they're saying. Things like that. Another thing is teens love music. So usually they're always like, they have their AirPods in and they're listening to music. So then it could be like, hey, play me a song that you listen to when you feel angry, or play me a song that makes you think of anger, or like maybe the artist wrote it when they were angry. And you could go through like all the different emotions. And I had a kid that was just really resistant. He was 13 and didn't want to be there. And when I brought up that, he was like really invested, like he loved it, and he was just really into that. So, and maybe it's like making a playlist of your life. Like we're going to make a fake album cover, and like, my child years, like this is a song I would pick to describe that. When I was a 7-year-old, like this is my song, I think. Or maybe they're making up their own album title, things like that. They're drawing their picture. That's something I've done before. I like collages with teens, like, and you can do collages on so many different things. Like it could be a collage, like with relationship building, it would be like, make me a collage to get to know me better, or gets to help me get to know you better. So they're putting a bunch of pictures, writing words down, the things that they like or they like to do. And then while they're making it, it can be dead quiet. You can play like some soft instrumental music in the background. I've done that to help them focus or to feel calm, that it's not just dead silent and you looking at them. And then I'm reflecting like, oh, like as they're doing it, I'm like, oh man, you are working so hard on this. Like that is so cool. Like you like skateboarding. That's so cool. I wish I could skateboard. Like I'm just making comments like that. Not the whole time because you don't want to be annoying, but every now and then. That's a good one. Just games that are, yeah, any games like getting to know you. It could be making a puzzle together. It could be trying to think. I feel like I had another one in my mind and it slipped. But yeah, even if you look online, there's a lot of interventions. So yeah, don't feel like they have to talk the whole time, because they're gonna hate you even more if you make them like. So usually once they feel safe, then the hope
Yeah.
is they will open up. But yeah, just meeting them where they're at.
So getting comfortable with silence.
Yes,
Yeah.
you have to be so comfortable. Yeah.
And one thing is when you're doing those interventions, like art and things like that, I mean, they're concentrating on that art too. So, and they may be processing through movement like that too. So let them process if you've asked them a question. So good. It's all good stuff.
Yeah. Yes, for sure.
Basim, you had a question?
A quick question. What
Yeah.
if you are experiencing the parent's problem firsthand, the same way the kid is describing it? So he's describing control, and the mom is control and trying to control you. Do you give that feedback or not?
Can you repeat that last part? So is the child's concerned about the parents? Is that what you said?
No, the child is feeling like mom's controlling me all the time. That's his complaint, and you are experiencing it firsthand from the mom. Do
Yeah.
you give
Yeah.
that feedback?
So it is so hard when they're teenagers, because with kids, it's like, I get to come in here and play and it's a blast. But with teens, sometimes they just need a place to like be heard and understood. So your work could be just like understanding his side of it and helping him navigate his emotions around mom. It could be that you meet with mom, and with teens, I'm always so careful, because like that family dynamic has been established for a long time at this point, like 15 years of their life. Like that is a very ingrained family dynamic. And sometimes I say, is this something you would want me to bring up to mom? Do you think that would be helpful? And maybe 50-50. Sometimes they're like, yeah, I really feel like this needs to be talked about. And sometimes teens are like, no, like, I feel like it's just going to make it worse. Please don't tell mom I've been sharing this with you. And in those cases, I may say, it may help. I may try to explain why I wanted to do it, but I'll never go against the child if they're, in their teenage years, and like share that with the parents. Because it's, you want the child to feel safe with you, or the teen, especially when they're in the teen years. I am a little bit more lenient, not lenient, but I err on the confidentiality with teens. I try to keep that trust with, whereas kids don't really care. Like they're like, yeah, tell mom about that. I've never had a child want to keep a secret from mom and dad. So yeah, with teens, it's like, yeah, they really don't, it's going to be messy and they know it. So
Yeah, that helps. Thank you.
Very good. Okay, y'all, it's 2 minutes till. So I want to give you guys just a little bit of break before we come back at 11 for the final training. But Natalie, as always, man, thank you so much. It was so good. I appreciate the time and what you give to others too. It's just a true blessing. Can't wait for more. And I'd love to get with you on. I've got a lot of notes written down on here on things that we can put together for everybody that to make that room and the counseling and everything. But very very good. So appreciate it. And it already is good. Don't get me wrong. But it just keep enhancing and making it better every day.
absolutely.
Awesome.
Well, thank you guys for letting me be here today. I'm going to slip off. I have a TSA appointment to get my pre-check, so I'm excited for that. So